We have others, but we're going to see the common we use IV fluid. Number one, we have normal saline. The normal saline, they have percentage 0.9, 3, 30, depending, but their name also changes according to the what, to their percentage. But now we're going to see 0.9% sodium chloride. Now, where do we use this fluid? This fluid can be used as a volume expander, like in severe dehydration. They first start by giving normal saline. Severe dehydration, they first start by giving normal saline, and then they give the other fluid, they bring us back to that we're going to also see. Normal saline also be used for infusing drugs. The drug that is also given in normal saline could be like oxytocin, mostly those who are augmenting labor. Midwives know this better. They use normal saline. Other drugs that are very common that cannot be given bolus, they put in normal saline and then it runs. For example, aminoplin. There are many quite drugs that is given in normal saline. So it's used in hypotension, and then also in shock, mostly hypovolemic shock. In organophosphate, when someone has taken poison, we give I think. Also in poisoning, is given dilute poison that is easily excreted through the kidney. Also is used in theater during operation. They give this normal saline to maintain good circulation. Also is used in bladder wash. Mostly those who have been done prostatectomy in bladder irrigation, they use normal saline to wash those things. So that is briefly, but it also has other things. It can also be used for diluting drugs. If you don't have water for injection, you can use normal saline for diluting the drug. So number two, we have ringer's lactate. Ringer's lactate also in severe dehydration. Give ringer's lactate. Severe burns, give ringer's lactate. In electrolyte imbalance. In electrolyte imbalance, you give ringer's lactate. Also, in use for making modified ringer's lactate. This one is also used for making modified ringer's lactate. Also in making cocktail, most in neonates they use cocktail. Though some hospitals they don't use this cocktail, but where I was before, they use this cocktail for those prematures and those small babies. Also, can be used in shock. Also in theater, if the anesthetist is running with fluid, you can use also ringer's lactate. We have strength darose. Strength darose is used in dehydration. In this dehydration, in malnutrition, this one is used in dehydration in malnutrition. It is one of the fluid that they use in malnutrition. if the child is suspected to have dehydration and is not responding through reservoir, then they give upstream direct, they put some dextrose also to give the child energy. Also using here in making cocktail for the baby. This upstream direct. Those are the scenario that I've seen they give upstream direct. Then we have dextrose. Okay, dextrose, we have dextrose 15, dextrose 10%, dextrose 5%, and then dextrose 25%. The commonly used one is 50, 10, and 5. So this one is using hypoglycemia, and then alcohol intoxication. This is where they use dextrose. They also use for administering drug. For example, quinine. They can use dextrose 5% for giving quinine to counteract the hypoglycemic side effects of quinine. Also, they also use for making modified fingers lactate. To make a 10% of 10 mils, you aspirate dextrose 50%, 1 mil, and then normal saline 4 mils. So can also be used for making modified fingers lactate, 25% in the ratio of 1 to 1, and then we have 10% in the ratio of 1 to 4 to make those modified fingers, depending on what doctors has prescribed. So, other fluids, that is there we have colloids. We have hypertonic, saline, those are other fluids, plus the rest that is there. Also we have this one of nutrition. If someone is not eating, they try to eat food, also it's not good, they also give that nutrition fluids. So that is all about the common fluid that they use. These are the commonly used ones. Others are there. So that's all. Thank you for watching, and see you in the next one.